Hey everybody, Dr. Jason Gross here. I'm going to talk about hip flexor mobility. I get a lot of people in my office with pain in the front of their hip, usually right here. It's pretty common. Standing from a seated position, the toe off, facing gait when you're running or walking. If you're feeling pain right in here, it's probably your hip flexor. So I'm going to go over two very simple things that you can do to help alleviate this stuff. Sorry, I just finished 21.2 CrossFit Open workout maybe 6-7 minutes ago, so I'm a little winded. So first, what you're gonna do is you're gonna need a ball. You need like a baseball, a lacrosse ball, something rounded and hard, okay? And what you're gonna do is you're gonna put this right in the front of your hip. If you have pain here, you're gonna find it. You're gonna know exactly where it's at. There's a hard bump of your pelvis right in the front here. If you just move just inside, when you fall off that bump, you're into the soft tissue of the front of the hip. That's where you're gonna pretty much focus on. You're gonna put this ball right in there, and you're just gonna lay right on it. Yeah, you'll find it, okay? It's pretty painful. You don't need to really roll over it. You can kind of, wiggle over it a little bit, but just kind of mash it into it will suffice. You're gonna sit there and do this for several minutes, 3-4 minutes. It's kind of painful, it's time consuming, but it works, okay? Just kind of hang out there and really mash in that muscle. After a few minutes, it's gonna alleviate, soften up a little bit, and won't be as bad, okay? After you've done that, we're gonna stretch the hip flexor. There's a couple different ways that you can do this, but I'm going to show you what I like the most, right? And there's a really precise way that you got to do this. So, we're going to stretch the left side. That knee is going to be down like this, right? Torso is going to be vertical, knee's going to be at 90 degrees, right here. I'm not just going to lunge forward. This is what a lot of people do, and it's not as aggressive as you can really get that stretch. So what you're going to want to do first, this is critical. You're going to want to pivot your pelvis up. Pretend you got a big old belt buckle, Texas style, and you're going to bring it to your chin, like that. Watch my pelvis. It's almost like there's a axis or a spool going through my pelvis, and I can rotate it around that spool. I'm going to bring the belt buckle up, just like that. I already have tension in that hip flexor now. I can feel it. Now what I'm going to do is I'm going to just lunge forward a little bit. This is as far as I can really get. Right? If I don't add that tilt, I can go a lot further, and it's not as efficient with a stretch. I've got to get this first, and that's as far as I can go before I start tugging. To make it even more aggressive, we're in this position, we tilt, we lunge forward to tolerance. I'm going to bend away and twist away like this, and now I'm going to feel that stretch up into my abdomen. The hip flexor actually starts in the lumbar spine. It attaches the 4 bones in your back, L1 through L4, and it's literally the lower body connection to the hips, the spinal connection to the hips. The hip flexor is the spine's connection to the lower extremity. It's a really important muscle, right? So, really important core muscle, very important with runners. Just a lot of functionality comes out of that muscle, right? So, if we mash the ball for a few minutes, then we do the stretch. We're gonna hold this stretch for about 30 seconds, get it aggressive, might as well do the other side, come back to it. Do probably a total of about 3 to 4 minutes of stretching after you've done this. I recommend doing this kind of stuff, any kind of mobility, whether it's hip flexors, shoulders, whatever, after you've worked out. Your body's warm, your muscles a little bit more supple, more pliable, and I think you could get a lot more efficacious mobility after you've worked out. So we do this for a few minutes, we do our stretch for a few minutes. I would be doing this every day, especially if you have pain right there. All right, try that out. I'm sure that'll help you out.